Well, good afternoon and welcome to the Flint Community Webinar on Coronavirus. This is week 113 on May 13th, 2022. Many people will have a little bit of concern because we talk about the Friday the 13th, but this is a good Friday the 13th. And we're so happy that you joined us for the Flint Community Webinar on Coronavirus, which is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. I'm excited today to be your moderator as one of the co-directors of the Healthy Flint Research Coordinating Center and founder of the National Center for African American Health Consciousness. I am bringing you greetings today from the George Mason University in Virginia. Arlington, Virginia. They're having a discussion these last couple of days on the equitable co-production of information and research. And so we've been talking about this webinar this last couple of days. This is in partnership with the University of Alaska Fairbanks, funded by the National Science Foundation. So I just want to let all of those of you that know that the information that happens here on our webinar is of interest to other individuals, communities across the US, and we should be hearing more about that in the next few days. It is a great pleasure to say to our partners every week how much we appreciate their participation in this. Today, we have representatives on the webinar as panelists that are happy to answer any questions that you might have as you're in the webinar. So please, for those of you that are listening via Facebook, you have the opportunity to put some questions in so that our team can monitor those. But also, if you're in the webinar today, we have a great presentation. So we want to make sure you know, put your questions in the Q&A. Today, we're going to be addressing COVID and infectious diseases, what you need to know. We have a special guest with us here, Dr. Shanina Knighton, who is an infectious disease preventionist, and we'll talk a little bit more about her in a few moments. And of course, our panelists, we got a great medical moment for you. You'll hear from the health department and others. Today, we are going to also make sure that you know what's going to be happening with some upcoming issues around the Flint water crisis and that settlement. So stay tuned. If you know someone that you think this may be of interest to today, please, they still have time to join us today on this webinar. It is you, and it's because of you and your input that we're able to continue to provide this information weekly, providing a local context to the global pandemic, understanding it isn't just coronavirus. There are other things happening in our community that we want to elevate in this conversation. So today, as I mentioned before, we have a special guest with us today, Dr. Shanina Knighton, who has tremendous credential. She is an infectious disease preventionist from Case Western University. But I also want to let you know, a few weeks ago, we had a presentation from our own Lydia Stars from the Community Foundation of Greater Flint, talking about some projects that they were funding in our community so that our community could be instrumental in helping us keep the word going on, keep the word about our testing sites, opportunities for receiving the vaccine, et cetera. And so we want to thank Dr. Knighton for being a consultant for us for the N-Nice project. So Dr. Knighton, would you please come on now and let's hear from you. What are some of the recommendations from your work as a infectious disease preventionist around COVID? Dr. Knighton.
Good afternoon, good morning if you're somewhere else, or good evening if you're somewhere else. So yes, thank you for having me, Yvonne. I'm here today to share information in regards to COVID-19 prevention, vaccines, as well as, information about the disparities within our communities. Next slide, please. So today we'll just cover what it is that we know so far. We'll talk briefly about the vaccine, and we'll also talk about some practical prevention tips. Next slide. But first and foremost, I do want to discuss and just tell people about an infection preventionist. And so we might see, let's say, terms, infectious disease specialist, which would, let's say, be an MD or a physician. We may see, let's say, an epidemiologist, which may study let's say, the statistics around diseases just in itself, as well as be able to quantify spread. But an infection preventionist differs in that we actually go through practical methods of preventing and controlling infections, which means that we must know the type of bugs that exist, how they thrive, test to identify them, and more so importantly, how to eliminate them from people and surfaces. And so, a lot of bugs that you may have not heard about before the pandemic because you may have not just been interested is because we typically work to make sure that those outbreaks, or let's say an epidemic, does not become a pandemic. And of course, every once in a while, we have those that slip through, such as H1N1. So that would be it. And so in hospitals, we establish protocols and procedures that focus on prevention. I've been doing so in the community, helping people to think about infection prevention from the practical standpoint, and just also reminding people that everyone was given a crash course in infection prevention overnight because we haven't had to think about how to incorporate it into our daily practices. And so today we'll go over some of those topics. Next slide, please. And so just some information. We know that there, of course, are the myths. There's the information that exists in regards to COVID just showing up. However, coronaviruses are not anything new. They've been around since the 1970s. However, this particular strain, which we know strains exist now, is because there is a different form of coronaviruses, which is COVID-19. We know that it is primarily infectious respiratory disease, even though we know that it has long term effects on others. And we also know that it primarily enters the eyes, mouth, and the nose. And I'll talk more about, our hands being a common factor of or contributor of how that happens. And we know that COVID-19 alone is responsible for 5% of deaths, which means that individuals that have had COVID-19 and have passed away, 95% of them also had other conditions, on average, four other conditions, according to the Centers for Disease Control. Next slide, please. So currently, we know that there are three vaccine candidates, two which are mRNA vaccines, and we have the J&J, which is a vaccine that contains the adenovirus. Next slide, please. The goals of the vaccination, and this was known like even before, and I know that the messaging may have got mixed up because there was this perception that the vaccine would eradicate COVID. But I remind people that we have to think about our blood pressure medicines, our diabetes medications, that these mechanisms are put there for us to reduce effects. They are put there for us to treat things. They are not put there to cure. So it is not a cure. And so the goal was to reduce the burden on our healthcare system. It was also to reduce the burden of symptoms, which could then cause other issues and complications for people that had other conditions. Okay, next slide. And so we know that individuals with certain conditions, whether let's say that they were an at-risk pregnancy, being an older adult, having obesity issues or severe obesity issues, heart conditions, smoking, because again, we're talking about respiratory. So it's an infectious respiratory disease. So impacting your lungs. So individuals that already had compromised symptoms were likely to have bad outcomes when it was co-associated with COVID-19. Next slide, please. So then now this is an infographic that was developed, and you'll learn more about my work in infographics as we continue to move forward. But this just is information that shows people, that getting vaccinated can protect yourself and protect others around you, but it also sends the message that you can still become infected with the virus. But being vaccinated may limit the severity of symptoms that you may have. This information is very important because now that we are having individuals that are vaccinated, there's this notion of being asymptomatic. And so people have to understand that hand hygiene is important because while you may not have any negative effects from COVID, you can still pick up COVID and still spread it to others. And so we'll talk a little bit more in detail about these individual preventative practices. And so, things to consider, and I bring this up if you are someone that is encouraging people to get vaccinated, if you are someone that is considering getting vaccinated, I do suggest that you go and get tested before being vaccinated. A lot of individuals may not talk about this, but it's just like the flu. We've all heard that myth or that rumor of, oh, I got the flu vaccine and it gave me the flu, which is a story. a lot of times people may not realize that their immune system may have been compromised, or they may have been on the verge of already getting sick. And then, yes, the flu vaccine, while it was trying to build up antibodies, may have already pushed you over the top. So it's very important to understand like what your status is, what your health status is before getting vaccinated. There are some individuals that may go out to an exposed party and they'll say, "Oh, well, I'm getting ready to go out and get vaccinated," because they think that they may have had COVID. But it's a suggestion that you actually wait, about 3 to 5 days before going to get vaccinated, because you don't want to already be at a compromised state when getting vaccinated. And so I know that this isn't something that is quite discussed often, but timing is still very important. Next slide, please. So, as we talk about vaccines and people are thinking about shifting the conversation, I always show this slide, which is from the National Notifiable Disease Surveillance System. And the reason why I share it is because we don't think about smallpox. So, smallpox is the picture that's right there on the left hand side. And you can see in the 20th century, like how many cases was held. And then, you look at now, like where we are. So, it does show that vaccines do help. Okay. The other piece is that I always remind people is when my grandparents and parents were coming up, they took oatmeal baths when it came down to chicken pox. Okay. And then for us, it was the calamine lotion and it was the chicken pox party. So because it was so contagious, everyone pretty much just kind of threw their kids out in the street and said, "Hey, let's get them all, you know, sick and then let them all get better." But now for kids that are younger than us, or I would say even our children, they have chickenpox vaccines, so they don't have to undergo the itchy bumps. And so this is just a notion that when people do, definitely talk about, well, vaccines don't work, we have to think about where we've come from and where we are right now. And sometimes we tend to not look back at some of the diseases or some of the infectious diseases that our parents may have had to deal with, or grandparents. Next slide, please. So this is a video, and so if as you can see, this is someone washing their hands. I just have to bring up that only 3 to 6% of people clean their hands correctly. So they always wash the front and the back, which we know. They tend to not think about the webbing of the fingers. They tend to not think about the fingertips. They didn't tend to also not think about, where the thumb meets the hand. And so there's germs that can actually get in that web. And then even afterwards, they don't think about the fingertips. And so scrubbing your fingertips actually helps to get some of the germs from under your nails. And then also thinking about cleaning your wrists, because germs, as you're moving from your hands up to your arms, and it goes from a notion of being clean to dirty. And so even during some of the best practices, some individuals may say, "Well, I don't know how I got COVID." But if you're not a part of that 3%, 3 to 6% that are cleaning your hands correctly, you could wear a mask and you can do some of these other preventative measures. But if you're not cleaning your hands, then that can be a big problem. Next slide, please. It's also the same thing with mask wearing. And so, as you can see in this visual here with this individual, I describe this as being chin girdling. So, a lot of individuals will wear their mask up under their chin just for the sake of saying that they have on a mask and think that they're protecting someone, but it's really essentially just holding their chins. And so what happens is, imagine you going inside of a building, you have your mask on correctly, but then after you come out of that building and you've been exposed to everybody, the droplets, let's say, was in the elevator, and you're thinking like, "Oh, I'm relieved. I can't wait to let down this mask." So you then pull the mask down beneath your chin, which was your exposed area. By the way, droplets can survive on the skin for up to 9 hours. So you've now moved it down to your chin, down to your neck area, and it's resting there for a while. So now you got droplets that's getting on the outside and the inside. What happens is when you go pull that mask up again over your mouth and your nose, you've now just transferred all of those germs from your neck area directly to your mouth and your nose. And so I always bring this up because it's not a matter of just wearing a mask, but it's practicing hand hygiene before and afterwards. It's making sure you're removing it from ear to ear. And it's making sure that you're using it appropriately based off of the guidelines, because it's not just about wearing it, it's about wearing it correctly, or otherwise it can become a contaminated object that can then put you at risk for germ transmission. Next slide, please. So then with the infographics, just as I was mentioning, taking information to people in a way in which they can understand it. So helping people understand that when cloth masks, were an option. And by the way, I just want to say whether it's an N95, a KN95, or a cloth mask, all masks still provide some form of protection. And so I don't want anyone to think that there isn't a such notion of protection, because there is. But this infographic was made of when cloth masks were available. And so many people don't think about how sensitive our faces are. And so this gave information about making sure that if you have sensitive skin, then maybe your detergent can't go on your mask, that has to go on your face, because it can cause you to break out. It's also reminding people that if they're out at a restaurant eating, it's not appropriate to sit the mask down on the table, but making sure that you have something to put your mask in so that way it's not openly exposed on the table. Also, too, not using your phone. So a lot of people don't realize it, but if I have my mask that's over my face and I have my phone up to my mask, all of the contaminants from my hand from touching my phone is now on my mask. And it's the same exact thing if I'm touching my phone. Anything that might have gotten on the outside of the mask that protected me is now on my hands that will come in contact with my phone. So it's making sure that we're paying attention to those factors. Next slide, please. Cell phones I described to be our third hand. If someone was to Google it right now, you'll find out that cell phones are 10 times dirtier than the toilet seat. Yes, including E. coli and a lot of other nasty things. And these are the items that, again, we put next to our face, we may text on, and we transfer these germs, let's say directly from our hands to our mask or directly to our face. And sometimes when our face breaks out, we think that we're breaking out because of something that we ate, but we're not realizing that the contaminants on our phone may have transferred to our skin. And it's important for us to make sure that we're cleaning our phone so that way we don't have outbreaks with our skin. Next slide, please. So I'm not going to talk about infographics for these, but these are more so just questions that you will want to ask when you're going somewhere. So we have to think about when we get a box of condiments, like let's say ketchup or, barbecue sauce. These items are inside of a brown paper box, and they're 9 times out of 10 sitting somewhere. Maybe some of the sauce is busted, maybe not. Same thing with the little cups. Well, they place the cups directly next to your food, but somebody's hands had to touch those cups to put them directly next to your food. So, just as a suggestion, I always tell people to make sure that they're not letting the condiments be sat right next to their food that they're getting ready to consume. And we know that this happens a lot, even out in fast food restaurants, but this is just to make people aware of some of the things that are being touched. And I'm going through this fast because there is the preventionsaveslives.com website that has some of this information on here. And as you know, this webinar is being recorded, so you'll be able to go back and reference it and be able to read through. But just for the sake of time, I'm just giving an overview. And so even now, as we're going outside and we're beginning to socialize, as you can see in the image here, if people are all serving themselves and it's a self-serve event, everyone touches the silverware and oftentimes, or the serving spoons. I've seen serving spoons land directly down on the food, which means that the serving spoons that are laying directly down over the food, all of those hands that have touched those serving spoons are now laying inside of the actual container itself. The other piece of that is as you can see, this gentleman is hovering over the food. So if he's talking over the food, then the droplets that are directly coming from his mouth is falling over the food. So I always tell people, if you're going to do self-serve, that might be a time to appropriately have people wear masks. I will also tell people to not talk over the food while they're getting their food and to socialize afterwards. I also bring up stacked cups. You don't think about it, but if you have a stack of cups and sometimes the cups stick together, you 9 times out of 10 are going to use your hand to grab your cup off top, which means that your hand has now touched the rim of the cup that someone else has to now drink from. And so we just have to think about how are we restacking cups and how are we using the things that are around us. Next slide, please. In office spaces, right now, masks are a big deal in regards to should we wear them, should we not wear them? Are people being discriminated against for wearing them? When are appropriate times for you to wear them? If you're in a closed in break room and you know that there's no open ventilation, then to me, I would suggest wearing masks. Same thing with kitchens and same thing with bathrooms and closed in spaces. If you're going to be sitting down, let's say at break room tables, you would want to make sure that you clean off the surfaces, because someone else could have been sitting there before you. They may have set their mask on the desk, and essentially you're walking into their germs. And so I bring these things up because we don't think about seasonal work changes, meaning, are we noticing that maybe Gina was out this week and someone was out 2 days later, and then someone was out 4 days later? We have to start then putting measures in place to say, is this some sort of outbreak that we now need to be cautious of? Next slide, please. Even for, I would say, our older adults or anyone that lives in, like, let's say a high rise, I would still be wearing a mask. If I was in an elevator, I would be cautious of my hands touching the elevator buttons because other people's hands are going to touch the elevator buttons. I would also pay attention in regards to how fast the elevator opens and closes. If it's one of those elevators that is going to hurry up and close you in it really quick, then you have to understand that it may not provide enough ventilation from outside air between getting on and off. And so that may again be the most appropriate time to wear a mask. And so even still now in elevators, in ride shares, I'm always wearing a mask for that very reason. And then too, finding out from the building manager how they're keeping track of cases and how they're keeping residents safe. And so these are all preventative measures that you will want to take into place. Next slide, please. Same thing with lifestyle habits. We know that smoking affects the lungs, COVID-19 affects the lungs. And so asking yourself, am I doing habits potentially that can be compromising my lungs further? Am I eating foods that are going to lower my immune system? Many people don't know this, but just 75 grams of sugar per day lowers your immune system for 5 hours. And so if you can imagine, that's a cup of coffee and a pastry. And so we have to think about the fact that if we're stressed out and we know that we're not working out, it might not be the time to consume sweets because then that just sends our body over into a mode of where we're going to be sick. Understand, even if it's not COVID-19 that you're sick from, being sick then compromises you for COVID 19. COVID 19 then compromises you for being sick for something else. So that's how it works when you have a compromised immune system. But we do know that individuals that had boosted T cells, when it came to COVID 19 early on, these were individuals that had a high T cell count, which means that instead of them eating foods with additives in them and preservatives, they were more so sticking with lean foods as well as with vegetables to build up their immune systems. Next slide, please. So I'm just going to end here. I'm not going to go too much into too much work, but I just want to show people this slide. I have this slide and then I have another one. And so as you can see, I have, I'm sorry, go back. So right here, this talks about May 2022, summer 2022, fall 2022, winter 2023. This slide looks just like the one that I put up May of 2020 when things were getting ready to open. So it says businesses reopen and restaurant outings, right? And I'm saying that now everyone's finally coming outside. We're 2 years later, but as you notice, guidelines are being dropped now. The last time we went through this, it was because everything was reopening after a shutdown. So everyone made it through the summer, everything was successful, quote unquote. But then the fall came and sporting events happened, which were in house. People were going back to schools and universities. People were indwelling indoors more because the weather was cold. You then had it to where we started to have a peak, okay, in COVID. Same way that we would have a peak in flu season. We know that flu season goes from September up until April. We know the peak of that season is between December and February. We have to understand that at this point, because even still, you see potential for COVID vaccine is there. So we know that we're working off the same formula for March of 2020, and that new formulas will be needed because we're constantly using, I would say, new tricks on the old dog, which is somewhat effective, but not as effective as it should be. Or I would say we're using old tricks on a new dog per se. So it's the same situation of where we were 2 years ago. And so the question comes is what should we be doing in order for us to stay safe collectively? Next slide. And so this is an example like of a Swiss cheese model, and it looks at the respiratory virus pandemic defense. And what it states is that there's not going to be one single layer of protection. Meaning, yes, hand hygiene may not save you from absolutely everything. Mask wearing may not save you from absolutely everything. Vaccines may not save you from everything. Even when it comes down to surface cleaning. But the thing is if you do all of these things collectively, you decrease your risk that is associated with you getting COVID-19. Next slide, please. And so when you're thinking about safe practices, of course, there is vaccinations which exist and, which is the emphasis that we place on. But this looks at what should you be doing in addition to being vaccinated. And so it's still the social distancing when it's appropriate, the hand hygiene and masks. When you're talking about office safety, or I would say workplace safety, making sure that you're looking at community use surfaces. If everyone's using the same elevators, touching the same door handles, how can you address that? Ventilation, meaning are there air exchanges that are occurring? Does your employer have the most up-to-date HVAC system, which is heating, ventilation, air conditioning system? And even when you're thinking about home visits, client interactions, or interacting with others, you think about ventilation. Do you have that? So this may mean even when it's cold outside, keeping windows open. A visitation plan, meaning that who are they bringing? So not just having random people come over, but having a plan for if they come over, and essentially knowing their status if that's what makes you feel more comfortable, and making sure that you have sort of hand hygiene protocols. So there's certain protocols when individuals come to my home that they have to do, just to make sure that they're ensuring their safety in mind. Next slide. And so this is another example of infographics. Again, a lot of individuals are not thought about, and this would be where you would again talk to your leaders in your community. So one of the individuals came and said, okay, well, I know that you have some information on what I should do to manage, my walker or my wheelchair while I'm out in public. What can I do to make sure that I'm staying safe? Because I have to go out and I have to touch commonly touched surfaces as well as touch my own personal belongings. And so being able to help them think through how that looks, as well as being able to clean their assistive devices. And so you can keep going because I'm not going to discuss all of these. You can skip this one. Okay. This one I'm just going to talk about briefly. And it's just that old people saying of don't talk over children. This is literally don't talk over children. I would also say don't talk over older adults. So standing over someone and talking to them, you're putting droplets down on them. And so always make sure that you're talking to children or talking to adults eye to eye. Next slide. I don't know about y'all family, but my family love playing cards. And of course, we can't wash the cards. And so this is just making sure that you're taking time out to even wipe down the table. We're all hollering over the table. The droplets are going to be on the table. The cards are hitting the table. So making sure that you're taking time out to be able to clean the surfaces as well as even for hand hygiene. It may to some seem cumbersome, but it's always best safe than sorry, because again, now we're walking around with a nice population that may be asymptomatic at this point. Again, just like how we were at the beginning of the pandemic, which is good if that means that not if people aren't dying. Okay, so it is good if people aren't dying, but it still means that we could be at risk for someone whose body may not necessarily be able to handle the disease. Move forward. Okay, move forward again. Move forward again. And so these are translated in Spanish. I'm briefly just going through the infographics, just to say that they are in different languages. And so the Flint COVID Community Coalition does have access to this information as well. Move forward. And this is just a video of how they've been used. And so they've actually been put into these infographic card sets and passed out to the community. And so someone can put this in their purse. They can leave it inside of their cars, just to have it. And it's really just to be mindful in thinking through it. And these were written by the community for the community, meaning that we actually went around and talked to people in the development of these materials, even asking people, well, why is it that you didn't follow up for your medications or go to your appointments? And the fact that they were saying, well, I didn't want to go there and get sick. And so helping people to navigate why it is they should still be going to get their medications, but ways in which they would do that safely, or to even see their doctors and do it safely. And so we can pass this too. The project is just stating how I've translated them. Even with my nursing students, we pass them out in the communities. And this actually provided them a way to be able to see the areas for which I grew up, which is Cleveland. So Cleveland is the largest poorest city. And with that, there's this perception that when you walk inside of the healthcare systems that exist here, which are some of the top ones in the world, that the patients that are seeing is reflective of that. But this was important because our students need to see that not everyone that is in the hospital setting that's getting top-notch care has the same resources when they leave the hospital. And so this helped them to understand that just because these individuals live in these neighborhoods and may lack resources does not mean that we shouldn't be thinking about ways to give them patient-centered care. Move forward. And this is just other ways in which the infographics have been used. And so they may have been used at food drives, and they've put them on foam core boards in order for people to think about ways to stay safe, and have become a conversation piece for them to engage with the communities about what they're doing to stay safe. It's also available here on our YWCA website. So for example, they use them and provided their communities information so they can download the infographics and use them for themselves. And we've also used them for our urban housing development here, where we made sure that every resident and every employee received them as well. And that's what I have for now. So I was going to say my Facebook and Twitter has been updated to Hey Dr. Nina now. So those two tags are different. But if you do want to stay in touch, or if you have any questions about the materials, then the information is available for you to stay in touch with me. Otherwise, the Prevention Saves Lives website, which is www.preventionsaveslives.com, does provide information in regards to safety tips. Thank you.
Dr. Knighton, thank you so much. I want to remind our listeners that you are the consultant for what we call the NICE here, which is a national network to innovate for COVID and adult vaccines. Wonderfully on mute. Thank you. Dr. Knighton, thank you so much. I just want to remind our listeners today that you are consulting with us for our NICE project with Lydia Stars talked about, that's funded by the Community Foundation of Greater Flint and CDC funding. It is the national network to innovate for COVID and adult vaccine equity. And so all of our partners that are part of that have access to this information, and you're sharing with us on a regular basis how we can be more helpful to our community. So what I want, you shared a lot of information with us today. So what I would like our listeners to do is to write down those questions. I know as you were talking, I grabbed right quick a towelette because I got to wipe down some things where I am. But this is information, we've heard it, but you've shared it with us in a unique way. So I want our listeners to please, let's utilize this, but write your questions down, put them in the chat. We're going to ask you, Dr. Knighton, come back and visit us again, and we'll just have a Q&A because you've provided for so much wonderful information here today. So stay with us. She's going to still be here for a few minutes. Put your questions in the Q&A and she can answer them directly. You mentioned, though, this is a long time and there's other chronic diseases that are impacted by this. Dr. Susan Wolford, who's one of our co-directors for the Healthy Flint Research Coordinating Center, is going to come now and give us one of those phenomenal medical moments. Dr. Wolford.
Hi, Yvonne. Ooh, I don't think you can see me. Can you see me?
Yeah, but I can hear you. Yes, and I can see you.
All right, awesome. Well, thank you so much for this opportunity to share with you about on our medical moments today. And I am going to share my screen because today we are going to speak about COVID and lungs. And I just want to say amen and thank you so much for the presentation that just went. There was so much phenomenal information. And building on that, we're going to talk about how we can protect our lungs, because we know that COVID affects our lungs during the time that we actually have the infection, and that many people who end up having the long COVID symptoms, part of what's impacted are their lungs. So clearly our lungs are really important to staying healthy. Hopefully, if we can have healthy enough lungs, we may be less likely to get COVID or less likely to get severe COVID and less likely to have long-term impacts of COVID. So as we think about our lungs and how we can keep them healthy, I would like to have us think about our lungs as a sponge. So I know people often say that lungs are like balloons, but all those little balloons together make it like a sponge. And when we go ahead and pollute our lungs, expose our lungs to things that they shouldn't be exposed to, such as vaping and carbon monoxide and all the things, marijuana, all of the tobacco, all of the things that we should not be exposing our lungs to, it's like spraying them with chocolate milk. That sponge is collecting all of that gunk, and that is making those lungs less and less able to fight infection. It's filling it up with toxins and toxicants that make it harder for it to do the job that it needs to do. And so with that in mind, I am going to let us look a little more closely into the structure of the lungs. So when we look at our lungs, if we remember, we talked before about these alveoli sac, those little bubbles that make up the sponge there, and the capillaries that bring the blood to the lungs and bring the carbon dioxide in so that it can be taken out and then take the oxygen out. There's a little space between that capillary and the alveoli, and the oxygen has to make it away over into the blood vessel so it can go to the rest of our body so we can be well oxygenated. And then the carbon dioxide crosses over into the lungs so we can breathe it out. Now, there's one thing that I didn't mention in the past that is important to know. We have mucus in those alveoli. And some of us know about that when you cough up and you cough up some phlegm, it's coughing up mucus. But even in the healthy lung, there is mucus, and that mucus protects the lungs. It, in fact, has some bacteria, a small amount of healthy bacteria in that mucus that helps to protect us. Now, there's an interesting fact I want to bring out. There's somewhere else in our body that also has healthy bacteria that we want to mention, and that is our gut. And there's an interesting communication between the two. So the healthy bacteria in the gut sends chemical messages to the lungs and controls when we get an infection or when we come in contact with an infection, it helps to control our immune response to that infection. So which is why it was mentioned that when we eat sugar, it impacts our immunity. And there are many reasons why, but one of the ways it does this is by impacting our gut, but the bacteria, the healthy bacteria in our gut. So if we want to keep our lungs healthy, there are a few things we need to do. We need to make sure that that gut bacteria is as healthy as possible by eating the right things. And that's going to be fiber, fruits and vegetables, right? Those help to keep that bacteria healthy. So it sends the best messages over. The other thing we want to do is to exercise, because that also helps keep the lungs healthy. We want to avoid inhaling all those pollutants that will stop the lungs from functioning well. And then there's one final thing that I want to mention with keeping the lungs healthy. I'm going to stop sharing here, and I'm going to suggest that if this is one of our alveoli, it should have a little bit of the mucus, and then the healthy cells can move around in there nicely. There's not too much problems. We just want to keep it nice and healthy mucus that's well hydrated. So we need to drink water. Now, we don't want to flood our lungs. That's not the point, because that's a problem if we have too much fluid on the lungs. But to keep our mucus nice and thin so that it can do its job well, we have to drink water. If we don't drink water, then it's thick and it doesn't let things move around well in them. It's thick. And I made this date syrup, so it was thick and dark, because both this person isn't drinking well and they've allowed lots of pollutants to get into their lungs. So we should avoid that. Avoid getting pollutants into our lungs, avoid getting dehydrated, and eat the right things and exercise. That will help to keep our lungs healthy and in the best shape to be able to fight off COVID if we should get it.
Thank you, Dr. Woodford. And before you go, you mentioned long COVID. And I know we talked about the lungs, and there are other areas in our body that are affected by long COVID. We're going to have a conversation about this a little bit later on, but can you just mention or talk a little bit about the importance of what we can do even if we've had COVID, persons who've had COVID, to help their lungs be healthier?
Right. So that's a really interesting question. And if you have long COVID, you should, in fact, be under the care of a physician who can help guide you through this. But all the things that I mentioned that one can do beforehand to help keep the lungs healthy are things that you can do afterwards to help them heal. So if you want your lungs to heal, good nutrition, the right measured amount of exercise, good hydration, all of these things will help. And some people think that deep respiration helps. So you could do it with me. You would take in a deep breath for 5 seconds, 2, 3, 4, 5, then hold it for 5, 1, 2, 3, 4, 5, and then breathe out for 5, 1, 2, 3, 4, 5. And doing that, letting your rib cage expand, helps to have those deep respirations that are also thought to help with COVID, but important to help with recovery from COVID, and hopefully helping the lungs to be strong enough to be able to fight it off and recover from it. But importantly, to be sure that if you have long COVID, that you are under the care of a physician.
Thank you, Dr. Woodford. Now, you know, one of the other big things we've tried to do is take some complicated language here and make it make sense for our community. So I'm glad when you said what did you say? Deep respiration. You explained that, taking a deep breath.
Deep breath. Breathe
but
it.
Also, just really quickly, we know about COVID, but when we talk about long COVID, and again, we're gonna have some more conversation about this in a couple of weeks, but just clearly for our listeners, that long COVID, you mean that is?
So we all know that we get infected by COVID, and many of us are better within 10 days. But if we're having symptoms months later, then we are in that long COVID phase. And those symptoms are really throughout the body. So we can have the brain fog that many people have spoken about. One can have the fatigue that many people have spoken about, the persistent cough. So there are lots of these symptoms, mood changes, a lot of symptoms that hang on after COVID, after the short initial high temperature, regular sort of symptoms that you think of with COVID, that you continue to have these other symptoms that go on for longer. And interestingly, I want to come back to that gut biota, the bacteria in our gut, because the studies are suggesting that not only do those gut bacteria change when we have COVID in very interesting ways, that people who have long COVID have more changes in their gut bacteria. So it might be, and this is, we say this is an ongoing experiment. So this is really just saying something that might be. It might be the case that making that gut bacteria healthier may help in the process of recovering from long COVID. And we should talk about that more, I guess.
Yeah, and I'm glad you said may, because we're talking about research, and that's always a touchy subject, but it's an ongoing investigation or ongoing look at things that are happening so we can find some good answers for these questions. So again, we're going to ask those of you that are listening, keep putting those questions in the Q&A and ask us these questions as we go forward. Even if we don't have the answers today, we'll do our best to try to get them for you. There's just this one last quick thing when we talk about long COVID. There are people who are experiencing a lot of different symptoms, and sometimes they say their doctors are not listening. and you work in the medical profession, and I know we pull on you a lot, but what are some of the tips that you would give to people if they continue to have these symptoms? How would they communicate with their primary care?
So thank you for asking that question, Yvonne. And first of all, I would like to apologize on behalf of my profession for anybody who may not be listening to their patients. And I know there are lots of pressures. There's time and other patients waiting and all kinds of things that cause sometimes those things to happen. And sometimes just lack of knowledge because we really just don't know a lot of the answers. Sometimes that makes it seem as though people are not, or sometimes people are not giving as much attention to it as maybe they ought because there's sort of all of this uncertainty. But I will say that the fact that we don't know all the answers and the fact that some people and some physicians may not listen as well as we should does not mean that you should not keep trying to get the answers that you need. So if you are having symptoms, I think it's always really good to write those things down. Write down, I'm having shortness of breath. I'm having it when I walk up 8 stairs, or I'm having it just getting out of bed. So write down the details of what you're experiencing. And then when you're going to see your, provider, let them know you have these questions written down so that they know they have to address these. And if it helps, take somebody with you. It's often helpful to have somebody else who's in your corner who can help ask those questions. Or if you ask one and then you don't get really a full enough answer, then the other person can jump in and say, but could you just address this again? So sometimes having that backup can also help. And at the end of the day, if you still are not getting the answers that you need, there are always that practice has a different physician or a different practice.
So you can get a second opinion, or you have the right to make a different choice about who your provider is.
You have a right, and you have the right to be able to do the best you possibly can for your health. So the first thing that you can do is do all the things that we've talked about, right? So you do these things, you eat well, exercise, drink the water, get the sleep, do those things that we've talked about so you can do the best thing for your health, and then get the best assistance from the medical system that you can get. And it is your right to get it.
Thank you, Dr. Wolford. I want to thank you again and thank Dr. Shanina Knighton for her input, because you're from the medical professionals. You're also doing some research in these areas. And so it's helpful for us as community to see you and hear you, and then have the opportunity to interact. So thank you again for your presentation today. We'll look forward to more medical moments. We want to just talk to our health department. Sherelle Brown has been with us for these many weeks now as one of the emergency preparedness health educators. She's going to give us an update from the health department, and really want to focus in, Sherelle, as you come to talk to us today about what's happening with the case counts in our community. Sherelle.
Good afternoon.
Good afternoon.
In the past week, our trend of new confirmed cases by referral date has increased by 24%. So we had about 438 confirmed cases between April 29th and May 5th, and 542 confirmed cases referred between May 6th through May 12th. On the screen is a dashboard of how many vaccines have been administered throughout Genesee County. As you can see, we are still looking at about over 63% of first doses being administered to 12 and up. And in total, 405,232 doses have been administered throughout Genesee County by ourselves and partners in our local drugstores. And so on this screen, from what I said earlier about the increase in cases, you can see that the total case count did go up from a week ago. This data was pulled and updated as of May 9th of this week. And so you can see that we are still seeing women being highly affected by COVID, and males are passing away at a higher rate than women. And we're also seeing that COVID is impacting our ages 25 through 29 age group, as well as 0 to 17 the most at this time. And when we first began this, it was our elderly. So it's important that we continue to push for safety, wearing the mask out in public, social distancing, especially in the schools where we're seeing cluster cases and outbreaks. So if you have not received your vaccination yet, tomorrow at the Floyd McCree Theater, there will be vaccinations for 12 and up only from 2 to 5 p.m. And then Tuesday on the 17th from 12 to 2 p.m., the Genesee County Health Department will be at Our Lady of Guadalupe. And then again on Thursday at First Trinity Missionary Baptist Church, there will be vaccinations on the 19th, ages 12 and up only. And then the health department will implement their every other week clinic on Thursdays at Shiloh Missionary Baptist Church between 3 to 6 p.m.
And Sherelle, while we're right here, I just want to mention too, we talked earlier about our NICE partners, and then there are also some REACH initiative partners. There are going to be a number of additional sites. So it's important that we encourage our participants. Please look at the health department website and listen to the community, because there's more opportunities coming up. So thanks, Sherelle.
Yes, there are many opportunities. And as you all know, you can get your test or your vaccination for COVID-19 at Word of Life Church Tuesdays and Thursdays between 12 and 6 p.m. or Tuesday and Wednesday at Bethel United Methodist between 2 and 4. On Thursday between 1 and 7. And then on Monday, Fridays, and Saturdays, Macedonia Baptist Church also holds a clinic where you can get your COVID test or vaccination between 10 a.m. and 3 p.m. And we all know, outside of the clinics hosted by our partners and the Genesee County Health Department, our local Walgreens and Rite Aids are also available to you for testing and vaccination. Hamilton Community Health Network is available. They schedule every 10 minutes on Tuesdays and Thursdays, so you can go get your test there, get a vaccination there. Visit your local pharmacy, Rite Aid or Walgreens.
Sherelle, one other thing, I went to the Rite Aid the other day, and I just want to remind our listeners, they do require a registration, even though they give the vaccines right at the drive-through, but they do want you to register before you get there. So just keep that in mind. If you're in a hurry and you need to get that vaccine from one of the clinics at the pharmacy, give them a call and get yourself registered so you can be ready when you get there.
Yes, and I did want to mention that it has been difficult to track at-home tests just because people aren't reporting them. So most of the results that we have received, they are coming from medical establishments and the testing sites that are in the community. So we do urge our community members that if you are testing positive at home, that you report it to the health department at gchd.us or give us a call at 810-344-4800. And both of those online and phone numbers can also be used for additional support to those who do not have access to the internet or our website. You can call us at that number and we'll be happy to do in-home testing as well as in-home vaccination.
Thank you so much, Sherelle. We appreciate the updates every week. And again, just to encourage us, we have these opportunities, let's utilize them. It is important for us to report those tests, even if you're getting your test at home and you're positive, please report that to the health department. Now, Kiana from the city of Flint. Kiana, so nice to have you on today with us. And we've got some updates that we need to hear from you.
All right, it looks like my picture is not showing, but that's okay. I'll go ahead. Oh, here we are.
There you go.
With the updates anyway. Good afternoon, everybody. I wanted to start with May is Love Your City Month, and the City of Flint, in partnership with Priority Waste, would like to invite residents to get all of the bulk trash together, all of the larger items that you've been looking to get out of your home, and get those to the curb so that you're able to get those carried away by priority waste. If you have any questions about specific items that they might pick up, you can give them a call at 855-927-8365, and they'll be able to answer those questions for you. Next slide. And very, very excited to announce this on Tuesday, May 17th. The city of Flint, along with our partners, that's the EPA, along with EGLE and MDHHS, will host a water infrastructure update. This will be a virtual event. Again, it'll take place on Tuesday, May 17th. That's next week from 5 to 7 p.m. Residents can attend the event by visiting the city's Facebook page, facebook.com/City of Flint, Michigan. And there will be a question and answer session at the end of the event. So please, we invite all residents to come out and join us virtually for this event and have your questions prepared. There will be representatives from the EPA, EGLE, MDHHS, and the City of Flint to answer your questions. And this weekend, over at the Flint Development Center on Martin Luther King, that's the Old Bunch Elementary School for the folks who've really been around a long time. The City of Flint, in partnership with the Plaintiffs' Council, will host an event that allows residents who have had that paperwork together for the water crisis settlement to come over and get assistance from the class attorneys. They will be set up at the Flint Development Center there in the auditorium on May 14th from 10 a.m. to 7 p.m. and then again on Sunday from 11 a.m. to 5 p.m. So if you've had any trouble with getting the paperwork finished, if you're confused about any parts of the process, this is the opportunity to get in with the plaintiff counsels, the attorneys, and get some support. You'll be able to sit down and get that support. If there are any things that are related to private matters, there'll be a private space to have those discussions with the attorneys as well. So please go ahead and join us. And just remember that paperwork is due. The submission date was extended and it is due on June 30th. And we don't believe there'll be any additional extensions. So this is an opportunity to get in and be able to get some help.
Thank you so much, Kiana. And this is so important. And I want to just emphasize how valuable the voice of our community members are. These things are happening because you've spoken out. And so for those of you that are listening and you've been assisting us get this word out, I'm so thankful every week when somebody says, I listened to the webinar because I'm able to take this information to other community members who may not be able to listen. And so thank you so much for that. Your voice counts. Another place, and Kiana, just if you can stay with me for a minute, we have a Water Systems Advisory Council meeting on Monday at 5:30, and it will be held at the Dome. And so this is a public meeting, Kiana, right? This is a public meeting. We will follow the Public Meetings Act. Did you have anything else that you wanted to share in terms of that meeting on Monday? We're looking forward to our community members coming out.
Absolutely. Flint residents are invited to attend the Water System Advisory Council meeting in person. It also will be cast on the city's YouTube page. So you'll be able to view and ask questions in the chat there. So again, as Yvonne mentioned, it is a public meeting and we invite all residents to come in and share with us any concerns, any good things that you see around what's happening in the water with the water in the city of Flint. So 5:30 on Monday here at the Dome. You can park here in the back in the employees parking lot and come in through the back door, and you'll have access to the Dome there at 5:30.
Thank you so much, Kiana. And let me thank all of you that joined us today for this webinar, week 113. We are getting more requests and information. We have an amazing presentation scheduled for you next week. So please don't miss it. Let me thank you again for joining us today. Social work credits are available for those of you who are social workers. Those contact hours, please continue to hang on a few minutes right after the webinar so that screen will come up for you. Continuing education unit for our community health workers. I again today want to appreciate George Mason University and the University of Alaska at Fairbanks for hosting this session that we're at today, and able to provide some information about what we're doing in Flint through this partnership with the HFRCC. And I want you to remember to like us on Facebook. Please like us on Facebook, subscribe to our YouTube channel, Healthy Flint, email us at info@hfrcc.org, or give us a call at 810-835-2130. And guess what? As it stands, we plan to see you again next week for session 114 of the Healthy Flint Research Coordinating Center's community webinar on coronavirus, bringing a local context to this global pandemic, because we're still in a pandemic. But we need to hear from you because your voice counts. Thank you again for joining us, and we look forward to seeing you again next week.